I'm going to trim this all anyways.
So are you writing those up for Kelly so we can hand them to her?
I think she has.
Okay.
The new ones I might,
I'm gonna make sure she got them on her phone.
because she forwarded the ones to me.
I don't know if you have that graphic still, Lily. Actually, it's 2 minutes till. Don't even worry about it.
I tried to edit. It has the date on it.
This applies to all our UI healthcare hospitals and clinics at all of our locations. Beginning tomorrow, our adult inpatient visits will be temporarily suspended. There are predetermined exceptions to this for women who are in labor with an impending delivery and for patients who come to our emergency room. Pediatric patients will be allowed 1 visitor per day, and that must be a parent or a legal guardian. Adult visitor exceptions may be made for patients with unique conditions or circumstances. As an example, if a request is made, 1 visitor may be allowed with a patient who is in a critical care situation or a patient who is having discussions regarding end-of-life care. Our staff will serve as communication liaisons. They're designated staff that will be facilitating communications among the inpatients themselves, the care team, and then the patient's designated point of contact. This will be done whenever the patient wishes. This was a difficult decision, and we have discussed it at length, and we know that it's the right thing to do to protect our patients, our visitors, and our staff. I'm happy to take questions.
Thank you, Margaret. Or not Margaret. So we are, just for the report, taking questions as we receive them, and if there are duplicate questions, we will try to consolidate them. So Dr. Brennan, this is from Zach Smith from the Press Citizen. Is the UIHC the treatment destination for any of the 71 infected Louisa County residents who need treatment? Additional questions, so we will let you go, and we'll pass it off to Margaret Reese with Mercy, Iowa City. Thank you, Dr. Brennan.
Great, thanks so much.
Good afternoon, everybody. Pleasure to be here again. Thank you very much. And I'll start by saying that we appreciate everyone who is practicing all of the precautions, who are staying home and practicing social and physical distancing. We know that that is difficult to do, but by everyone doing this, you are helping all of our providers here and at the university and throughout this Southeast Iowa region. You're helping your neighbors, your friends, your family, your colleagues, and your community by doing your part to help keep others safe and not helping this virus to spread. So thank you very much, and please continue to follow those precautions. As of 8 a.m. today, we had 6 patients who are positive and 7 who are awaiting their results who are here in the hospital. And this is day 37 of Mercy's COVID-19 response. In the last week, actually the last 4 business days, we have extended our telehealth options to additional patients by making devices available at 3 clinics so far, with others planned. And this assists patients who either do not have their own devices or don't have devices that are capable of telehealth, whether those are tablets or computers or smartphones. Or perhaps they do not have any internet access, or they do not have reliable internet access. And this includes 2 of our rural Mercy clinics in Tipton and Columbus Junction. So this is an opportunity to continue to stay in touch with patients and help them and keep them safe and from having to come to a clinic situation. We are working very closely with our local care facilities to help with discharged patients, whether they are going from the hospital back to where they live, or whether they are being discharged to a facility for either a short-term or long-term stay. So there is a wonderful coalition in the community, and we are working closely with them and appreciate everyone's involvement and assistance. Yesterday, we completed a new employee orientation virtually the first time, so no one had to come into the hospital. We completed electronic paperwork as well. So we really have ramped up in the last month all of our capabilities using technology to help keep people safe. Last week, I mentioned that we are at the point where we need to start making our own gowns for clinicians. And we had staff members who volunteered to sew them out of sterile wrap. We have about 200 that were completed last week and sent them off to our commercial laundry, and they actually survived that process. So we now know that we have reusable gowns, isolation gowns that are going to be very, very helpful because, again, the supplies of things like that and masks are not terribly reliable, and they are in their critical need across Iowa and across the country. So we're taking some steps on our own. We have received many donations of cloth masks from individuals in the community, many other supplies, and many meals for our employees, which they appreciate very, very much. And we appreciate all of these many contributions and the continued donations of cloth masks and gowns. And actually, we recommend, along with the CDC, that individuals wear a cloth mask or a face covering when they are in public. So that really is a good practice. And we all have them now here in the hospital, and we wear them here. So we all have our faces covered. And again, it's a way to prevent the spread of this virus. We do, again, encourage people to remain calm, to stay home, to stay away even from loved ones, which I know is very, very hard to do. Many of us are having to do that. Wash hands, clean surfaces often, and follow, again, all of the precautions, because you are making a positive difference in slowing this virus by following those precautions. It doesn't sound that complicated to do, but in reality, it's very, very hard day after day. And you're helping all of our caregivers here by doing so. And please continue. And we appreciate that very much. Are there any questions?
Hi, Margaret. We do have a question from Lee Hermiston with the Gazette. He says he would like to know if Mercy Iowa City is working on establishing any temporary housing options for your staff.
We have our guest lodging facility here in the hospital, and we are utilizing that right now. We have 15 rooms with their own bathrooms, and those are typically available to family members and others who need to be close to a patient, because many of our patients come from quite a distance. And if you have a loved one here and you don't want to be driving 30, 40, 50, 60 miles back and forth every day, they can stay in those rooms. And so it operates like a little bed and breakfast almost. And so we have those rooms that we are using right now. And if we would expand beyond that, we have many hotels that have offered us extremely low and really generous rates that we can use as well. But right now our guest lodging is meeting the need that we have.
Okay, now we have a couple questions from Zach Smith with the Press Citizen. The first one is Mercy the treatment destination for any of the 71 infected Louisa County residents who need treatment?
That is not information that I would have access to, and I don't know.
We have a few questions from Travis Brees with KWWL. Has the drive-up testing facility and the acute respiratory clinic outside helped relieve staffing at the hospital?
It hasn't changed staffing at the hospital at all, but it has helped in our clinic situation, not so much with staffing, but with the conservation of PPE and also reducing the potential spread of the virus. Because if patients call with respiratory illness, they can be directed to the facilities that we have in Coralville, and receive the care that they need there without having many people going to a variety of different locations. So those are the reasons for having the drive-up testing and also the acute respiratory clinic environments that we have.
Great. So we have a question from Kate Payne with Iowa Public Radio. It is related to Zach's question from earlier. Is Mercy Iowa City planning for an influx from other counties that can't handle COVID? And what do those projections look like?
We are just looking at the various models that exist for Iowa. And, we have patients who come from throughout the entire southeast quadrant of the state. So east, west, and south to the Missouri state line. And so we are prepared to take patients from any of those areas. And we are just handling and assisting those who are coming to us now, and hoping that nobody in Iowa sees a huge surge in patients, but we're prepared for them.
So we're not seeing any additional questions, but as with Dr. Brennan, we're going to give it a minute because of the lag in the live stream. So we'll just wait for 1 minute and see if we have any additional questions.
All right, thank you.
All right, I think we're good. Thank you, Margaret.
Thank you very much. Goodbye.
So we will bring in the rest of our live speakers, but I do just want to reiterate, we are having some technical difficulties. Our stream is a little slower than it normally would be, but we are also recording this, and we will share it post-production with both members of the media and the general public. We will post it on our Facebook page and YouTube Live as well, or YouTube as well. All right, now we have Sam Jarvis, Community Health Manager with Johnson County Public Health. Thanks.
Good afternoon. Johnson County reports a total of 216 positives for Johnson County, with 75 of those who have recovered. But today, we wanted to provide you a quick update on our disease investigation process. In anticipation of more cases and the rapid response that we're in, the department's disease investigation team is up to a total of 4 individuals, along with 3 other staff to support various pieces of that workflow. These are all internal staff, and we're grateful for their efforts to adjust so quickly to this change in our response to COVID-19 and be able to rely on their public health skills and knowledge. So thank you to them. We continue to get notified of cases throughout the day from the disease surveillance system, which we've talked about before, which includes the amazing work that the State Hygienic Lab continues to do through the addition of multiple shifts and the around-the-clock care and effort our hospital partners do to care for their patients in our community. We've looked at our processes and how to scale our response, so this addition of staff and increasing our capacity through other technological means to contact the public and collect information on those who have tested positive allows us to continue with our commitment to investigate, follow up with cases, identify close contacts, and provide recommendations to prevent further transmission. And with that, I'll take any questions.
Yeah, we've got one here from Travis Breeze with KWWL. Aside from the 24 cases being reported in Johnson County on April 9th, we have not seen a dramatic increase in cases throughout the county last week. Do you see this as encouraging? Have you been monitoring it? And is there perhaps a lag in testing that we could see an upswing later?
We're happy to see that there's been a lower amount of cases, and we're happy to see that, but certainly not letting that scope get away from us, and we're obviously anticipating more cases in the future. So It's good news, but certainly not something that we're looking at as a prediction for the future. All of the work that we've done so far to enhance our ability to continue to do disease investigations have been in anticipation for more cases.
And a follow-up to that, as your department continues to check on these patients and do tracing, Dave Coach mentioned that there'd be a point at which your staff would be spread very thin. Have we reached that point, and when will that transition occur if we do get to that point?
We're not at that point yet, but as I just spoke briefly before, adding on other staff and looking at other technological ability and capacity to be able to conduct our investigations and contact tracing, we're putting that in motion this week. And so we're not there yet, but that certainly is a possibility and a concern.
This question is from Sarah Watson at the Daily Iowan. There was a COVID-19 case reported of a staff member who works at the Oakdale prison. Does Johnson County Public Health know whether that person interacted with other staff members or inmates while they were infected? What additional actions has the person taken to make sure that staff member hasn't infected others?
Again, we're not releasing identities or we're places of business who've had positive patients. I will tell you, though, in general, when positive cases come through the disease surveillance system, we contact those individuals as well as their healthcare provider. And so they're getting contact from 2 different agencies about what they can do to prevent transmission. A part of our process is to conduct that disease investigation and perform contact tracing. So if that individual were to have household contacts or prolonged contact with other individuals, that's part of the disease investigation process.
Okay, Sam, we have some additional questions here from Zach Smith with the Press Citizen. How do infections in nearby counties inform decisions being made here in Johnson County?
Certainly. So we're looking at what's going around the entire state. The state health department has provided that information on a county basis. And we know and can recognize that sometimes when those cases uptick pretty quickly, that it might be associated with a clustered outbreak. But we're certainly aware of what's going on in our region. We're in contact with our other local public health partners as well.
So do those surges in, say, Louisa County translate into any escalation or changes in the things that the Johnson County Public Health Department is doing?
You know, certainly we recognize that there are a lot of residents that live and work outside of Johnson County and in Johnson County from other counties. So that's a possibility. As we said, we are always anticipating and looking at what it would look like to get more cases. And so the provisions that we put in place are for very specific instances like that.
Okay, this question is from Kate Payne from Iowa Public Radio. Are there any other long-term care facilities in Johnson County that have confirmed cases, and what steps are being taken to protect and to test residents and staff?
Again, we're leaving the notification to the residents and of those facilities up to the agency and the organization. We're not confirming or identifying those businesses as per code, as we've mentioned before. But I can tell you that throughout this entire process, we've actually established a daily long-term care and assisted living call here in Johnson County. And this has been going on for several weeks now, every day, with those facilities and being able to reach out and connect with them and ascertain any other needs that they might have with staffing or PPE or personal protective equipment or other sanitation needs, any other questions that they had that we can send up to the state. So I would tell you that for the past several weeks to months, we've had this communication network with them. And so that's one of the many provisions that we put in place here in Johnson County.
This question is from Sarah Watson at the Daily Iowan. Does Johnson County Public Health work with people who live outside the county as they are doing contact tracing?
Typically, we do not. We leave that to other county health departments. And so that process is coordinated through the state health department. And so we've got regional and other field epidemiological staff that assist with that. And so certainly we're in communication. So if there are instances where persons are traveling back and forth or maybe live in one county and work here, we're definitely in communication with them and the state health department.
All right, it looks like we don't have any further questions, but again, we're going to give it just a little bit of time to make up for the live stream lapse.
All right. All right. Thank you.
All right, now we have Patty Fields, Vice President for Impact and Engagement with United Way of Johnson and Washington Counties.
Good afternoon. Today I'm speaking about the United Way Disaster Relief Fund. And this fund was actually established in 2006 with the response to the tornado that came through Iowa City and has been mobilized ever since in times of disaster that have come through. This disaster fund is available for assistance for individuals and families who are impacted by all of the things involved. This year it was mobilized on March 16th for donations and is still available for donations, and then opened on April 1st to receive disaster assistance requests from households. And I would tell you that in normal times of disaster, we have received a lot of requests for property damage and things like that, which would normally impact. But this is a new time, and this is a much greater impact on many more residents. Normally, what we know from our ALICE data that 38% of households in Johnson County are either at the poverty line or are working and struggling to meet basic needs on a month-to-month basis. We are also seeing some residents who have been able to meet those basic needs month to month, but then now impacted by the COVID-19 types of needs, they are really starting to be anxious and worried, and how do they meet those needs? So since then, we have been receiving those requests, and we also know that with these times, there's less money for rent, there's less money for just the basic needs, and the worry day to day on that. The phone number to call if there are individuals who need disaster assistance is 319-259-9218. Since it was opened on April 1st, we have been receiving requests, and that's right now we are up to 54 households making requests for over $46,000 in need assistance. That is impacting 78 adults and 74 children. So that is a good example of the need is wide and deep, and we are just in the first months of trying to figure out how families are going to be able to meet the things that they need on a day-to-day basis. I would take any questions that...
Patty, can you share any website where we can get additional information if necessary?
Sure. So the website for our disaster assistance and any of the disaster-related information is on the United Way website at unitedwayjwc.org. There's actually a COVID-19 information page, so it will get to all the different information from there. The disaster fund also is prioritizing at this time rent and medications and those household supplies that are desperately needed that they wouldn't be able to find in other service organizations. At this time, we all have to work together and collaborate and not duplicate services. So whatever we can do to partner together so that we can meet as much need as possible is going to be very important.
Okay, we don't have any questions at this time, but there is a delay, so if we could just wait 1 second.
Great, thank you.
All right. Now we have Rochelle Honey Arcement, Director of Mobile Crisis Outreach with Community Crisis Services and Food Bank.
Thank you. As we near the 1-month point into the COVID-19 crisis here in Johnson County, it is important to remember our mental health and the impact this crisis is having on those who continue to work in their workplaces and those who are working from home and social distancing. This experience has been traumatic for us, but there are ways to decrease the lasting effects that it may have on our mental health. According to Bessel van der Kolk, a preeminent trauma researcher, there are 7 elements of traumatic situations that greatly increase the likelihood of people developing post-traumatic stress disorder, or PTSD. For many people, during this current crisis, some, if not all, of the following elements may be present: lack of predictability, immobility, loss of connection, numbing out and spacing out, loss of sense of time and sequence, loss of safety, and loss of sense of purpose. There are specific things that people can do to eliminate these elements or decrease their impact. So, lack of predictability. Have a schedule for yourself. Include things to look forward to. Create a calendar of connection opportunities. Immobility. During stressful situations, our bodies go into fight or flight reactions. But flight is not readily available right now for many of us. This leads to an increased risk of fighting. To decrease this risk, we need to take action using our bodies. Use those stress hormones to do things around the house. Cleaning, repairs, crafts, and exercise can help. Use self-regulation activities to regulate your hormones. Activities like yoga and meditation, mindfulness, and breathing exercises. Loss of connection. We are collective creatures. We are at risk when we are not seen, heard, or acknowledged. We need to make visual connections with others, to connect emotionally with others. It is through sounds, facial movements, and the give and take rhythms created through visual connections that keep us feeling alive. Numbing out and spacing out. Both are natural reactions, but we lose our sense of agency and our sense of control over our own choices when we numb or space out too much. We need to do things with our bodies to feel connected to ourselves. First, notice yourself. How do you feel? Where do you have discomfort? If you don't notice yourself, you react automatically out of anger, fear, or irritation. When you observe yourself, you can start to make choices. If you find it hard to connect with yourself, connect with others who can help you notice yourself and name your feelings. Have compassion for yourself and your reactions. Acknowledge that your feelings, even anger and fear, are helping you to survive. Loss of sense of time and sequences. When we are traumatized, time stops. It feels like this moment will last forever. We lose track of what comes next, and that things could ever be different again. We need to regain a sense of time. Notice the differences between every moment. Nature can be a powerful reminder of the sense of time and sequence. Nature continues its path through the seasons. Things are slowly becoming green again. Take notice. Marvel at it. If you can't get outside, there are wonderful nature shows to watch, the beauty of our world and the sequences of life. Loss of safety. Identify what makes you feel safe. Try to recreate that as best as possible. Remember that we all need privacy, a space to withdraw. Even in tight spaces, this can be created and communicated. Recognize the stress that everyone is feeling. Be patient with others and yourself. Reach out for help if you need it. Loss of sense of purpose. We all need a purpose, a sense of who we are and why we are here. With social distancing, we may not be engaging in the activities that usually give us a sense of who we are, or we may be facing difficulty in being as effective as usual in our workplaces. Find activities that affirm who you are. Engage with people who have similar purpose. Find ways, however small, to make a difference in the life of someone else. Remembering when interacting with others that we are all in a stressful, traumatic time, and we need to be mindful of how we are interacting with one another. Have patience, be respectful, be kind and generous, and listen. We often forget the power of listening and just being there for one another. We tend to want to fix the other person's problem, but sometimes there is nothing that can be or needs to be fixed, and our power lies in our ability to hold space for the other person and listen wholeheartedly. We are all in this together, even if we cannot be physically together. Our crisis line, text, and chat are available 24 hours a day, and mobile crisis is available face-to-face via video telemental health 24 hours a day if you are needing to speak with a counselor, day or night. You can go to our website at www.builtbycommunity.org to find more resources for mental health. We also have a support group for providers called STOP, Secondary Trauma of Providers, for providers who are feeling the stress of the work that they are doing. Information on that support group can be found on our website as well. Thank you.
This question is from Emily Chavez at KGAN. Are there any support groups in the county for people who have lost loved ones to COVID-19?
So I'm not aware of any support groups specific to loss of through COVID. I do believe there are some grief support groups. I know like some of the funeral homes have had that. Also hospice has support groups for loss, Hospice of Iowa City. So I'm not sure about specifically to COVID, but I do know there are resources for loss in general. Mm-hmm.
All right, and now we have Josh Hamburger, president of Think Iowa City.
Good afternoon. The CVB, much like our partners at the Chamber of Commerce, Iowa City Area Development, and the Iowa City Area Business Partnership, clearly recognized how quickly this pandemic began to impact our local economy. In the area of economic development I'm closest to, this was quickly seen through the hotel community, where we saw an almost immediate drop of hotel occupancies from about 70% per night to about 10% occupancy in the market. This impact was certainly immediate and felt across all areas of our economy and industries. Our Convention and Visitors Bureau, also known as Think Iowa City, quickly partnered with our economic development peers, the Iowa City Downtown District, the Business Partnership, and Iowa City Area Development, to quickly streamline communications and resources. We formed icareatogether.com. Again, that's icareatogether.com. It's an up-to-date website that's relevant and provides relevant information specific to a number of state and national assistance programs, including the SBA programs that have been rolled out, state and federal economic development programs such as PPP, the Employee Retention Credit Program, and other activities related to the recent passage of the CARES Act. It also includes a number of webinars that our four organizations are sponsoring and hosting weekly, many times several per week. Tomorrow we will have our second State of the Community webinar. We've had 4 of these in total, with tomorrow being the 4th. Last week was focused on healthcare and included many of the folks that you've seen earlier in today's press conference. Tomorrow will be centered around what's happening in our arts and culture community, which, much like the hospitality community, has been completely devastated by COVID-19. The website also includes a number of resources for local residents and our neighbors, with many ideas and activities that community members can take advantage of during this time of social distancing. We stand ready to continue to support our local business community, and more importantly, we're doing everything we can to prepare for when we are through this to bring the business back to the community and continuing our work for conferences, events, festivals, all of those things that make this community so great. Happy to answer any questions.
Josh, as we look at a lot of these festival closures and things like that occurring in our community, do you foresee the addition of new events later this fall as we recover to help our business partners and community repair and redevelop our economy?
Certainly. We're doing everything we can to reschedule or postpone instead of cancel. We have, I think it's probably the 48th or 49th consecutive year that Iowa City has hosted the Old Capitol Criterium that's scheduled to be at the end of this month. We're doing everything we can to try to move that for 2020 into the fall. There's a number of other festivals and special events. I know North Liberty had to cancel their Blues and Barbecue yesterday. There's a Run Krennic Marathon that we helped coordinate. They've turned that into a virtual run, which is a great way to do that. Anything that we can do to postpone to the fall, we're going to try and do, but then that schedule becomes quite complicated, so we'll probably be looking at 21 for most of these.
And as you put those postponements or reschedules out there, is that going to be on the Iowa City Area Together webpage?
Yeah, IC Area Together. Also through our individual organizations' Facebook and social media accounts, we've been doing everything we can to continue to operate. We all, even though we're all economic development organizations, serve a slightly different audience. So as it relates to festivals and special events, I would encourage you to go to thinkiowacity.com to learn about all those particular activities.
Okay, this question is from Emily Chavez at KGAN. Do you know of any hotels that are offering reduced rates or rooms for healthcare workers in the area who don't want to risk the spread to their family at home?
Yes, there's actually a number of programs. I appreciate that question. We've been monitoring that daily, particularly our organization. We've assisted with Shelter House and DVIP with some rooms that have been needed there as well. But for healthcare and frontline workers, both Hilton and Marriott have come out with pretty terrific programs to provide complimentary rooms to folks within those frontline medical staff. You can contact our organization or just go to Hilton and Marriott's website. By my count, as of yesterday afternoon, there had been 25 rooms through 8 reservations by local frontline medical that have taken advantage of that opportunity through our community's Hilton and Marriott properties. All right, thank you for your time.
should have waited before. All right, and finally we have Dave Wilson, Director of Johnson County Emergency Management.
Thanks, everybody. Good afternoon. Just want to talk a little bit briefly about supplies. So, as you know, with this global pandemic, supplies continue to be a challenge nationwide, globally, and locally. Here in Johnson County, we're at about 20,095 masks, about 30,000 procedure masks, a little over 11,500 gloves, and that's all from locally sourced, local taxpayer preparedness fund expenditures. The state federal equipment that's come in, 4,430 N95 masks, 600 Tyvek suits, 1,609 gowns, about 6,265 procedure masks, and then we've got approximately 42 vents that have all been locally sourced or brought in through mutual aid agreements that are out in the hands of hospitals in preparedness for any surge that would come. We continue to work with our partners at the hospitals locally, medical examiner's office, and the first responder groups to be prepared for any surge that would come. Obviously, if you look at the models, you know that in the next 2 weeks is kind of when they're predicting a peak for Johnson County. So we are monitoring that daily. We have a situation brief every day, 3 o'clock, Monday through Friday, with the hospitals and a multitude of partners. So we've got a pretty good feeling of what's going on in those hospitals, number of patients on vents, any deaths that have occurred, what they're seeing in trends, volumes up, volumes down, et cetera. Same way with local care centers. That's continued for, over 30 days now. That call happens every day at 10 a.m., so we got a pretty good pulse on what's going on in our care centers. We continue to plan for the worst and obviously hope for the best, though we've seen some increases every once in a while, day to day. It hasn't been a consistent, steady trend up. We'll have a couple bad days and then it'll kind of dip down, so we're really trying to monitor that. The preparedness message needs to be the same. We would like everybody to continue to do what they can to limit exposure, limit travel, use good hand hygiene, monitor your temperatures if you're feeling sick, stay home. Try and limit those exposures to the most vulnerable group of people. And through that, we'll all get through this. This will come to an end at some point. We'll have better testing, more available testing. There will be, immunizations, et cetera. And so we just need to keep a positive attitude and do what we can, socially responsible, to try and keep other people healthy, especially those that are most vulnerable. With that, I would entertain any questions that are coming in. Brad?
Dave, we have here one from Zach Smith with the Iowa City Press Citizen. How do the infection rates in nearby counties inform our decisions here for planning in Johnson County? I assume he's associating it with transporting possibly patients here.
Sure.
And things
so
like that
as you
between
know,
counties.
the corridor is a big region, right? So I, for instance, live in Lynn County, but work in Johnson. I'm far from the exception of the rule. And that goes on throughout the metro area, folks transversing back and forth between Lynn, Johnson, Scott, Blackhawk, you name it. So we do monitor those case counts in other counties, and more importantly, we monitor what's going on at the hospitals, because even though we see case counts rise or dip, or people recover in different counties, we really use the barometer of what's going on in our healthcare infrastructure to gauge what's going on. We're not as concerned about the number of people at home that are diagnosed positive as we are the number that require medical care, because that's what we're trying to avoid, is a surge and overrun of our medical infrastructure. So we do monitor those, we do plan for those. We get reports as well, just like everybody can see globally on the statewide page. I'd recommend people routinely visit those statewide pages through our Department of Public Health and Governor's Office. We share information with the RMCC, which is our Department of Public Health's partnership with the healthcare coalitions and the National Guard. So we're looking at all that, and we monitor it, but it doesn't incite panic in our planning. It is something that we use as a planning tool, but we realize there's a number of variables, and the most important for us is that control of what's going on in our hospitals, well, not only in Johnson County, but that macro view of regionally in eastern Iowa and then statewide. There are some hospitals in Iowa that just have a few, some have none. So it really varies based on hospital.
So given that outbreak that we saw in Louisa County and the exponential nature of this infection rate, has that changed any of that, or was that already built into the planning process?
It was pretty well built into the planning process. I think what you're seeing is when they have an outbreak at a factory, and it could be insert factory name here, where somebody gets sick, and we've seen stories on Amana refrigeration. We've seen stories on some of the different plants in Cedar Rapids. Those happen, and we have to prepare for them. And I think that's what you see with a lot of these is industry, whatever the industry is, insert name here, will have an outbreak, much like you see at some of the nursing homes. So we do plan for that. Again, our barometer is more so how many of those people require hospitalization and hospital care.
Okay, this question is from Travis at KWWL. How often do you have to make a decision where does this shipment of masks or ventilators go to a hospital or a long-term care facility?
Oh, routinely. I mean, our triage hasn't changed one bit from day one. We set our priorities and strategies on day one, and those continue to be the same, and I stand by them until this is over. You know, we're going to continue to make sure that the hospitals have the PPE and the medical infrastructure equipment they need to care for the people that are hospitalized. We're going to continue to focus on the nursing homes that have the most vulnerable population, especially those that have case outbreaks. They're going to be at a higher tier. And those facilities that don't have as high a vulnerability, that are, you know, a different type of business that might have case counts, we've got to gauge that. And it's a balancing act. It's triage. You know, I spent 30-some years in public safety and was a paramedic. There were multiple times you have to do triage, and this is no different. So we triage equipment and supplies just like we would triage patient care in the field when you're overwhelmed.
So we had another question here from Sarah Watson. Can you give us a sense of whether the numbers of supplies that you have coming in you think are going to be adequate for the hospitals? And then she followed up with, is there a particular item that you think you're in most need of right now?
Yeah, I think the thing that we all get concerned about is a rush on any of the hospital infrastructure, any of the 3 local hospitals or Eastern Iowa. Obviously, we worry about ventilators. That's why we made sure we've got over 40 additional surge ventilators available at the 3 hospitals. We worry about personal protective equipment. That's why you've seen University of Iowa do some unique things like re-sterilization of equipment. Obviously, it concerns me when I see people going around in public in N95 masks, and I know we've got healthcare providers struggling for those where they could be just as protected, like the ladies I see here in the room with the homemade surgical ones that have the reusable, recleanable filters. I mean, let's try and triage that medical PPE for the people that are truly on the front lines. You won't see me on an interview or in public wearing a KN95 mask or any type of N95 mask. If I was doing patient care, direct patient care, I would absolutely want and need one of those, and I think that's absolutely appropriate. But when I go out in public, I would wear one of those simple surgical reusable home sewn masks. So those are probably the most common things that we're worried about is respiratory protection, ventilators, that type of thing. It kind of ebbs and flows on gloves. We'll be low one day, we'll get more. N95s, KN95s. Again, the supply train just plays catch up. We have good days and bad days. One day we were entirely out of everything. Next day we got a large shipment. So that's just preparedness in a disaster. Anything else? Travis only had one? Hillary? Okay. Okay, well, thanks everybody, and enjoy your windy Tuesday.
Thank you, Dave. And once again, thank you to all of our community partners and for those members of the media who participated. I apologize again for the quality of the live stream, but as I mentioned at the beginning, we will we did record it as well, and so we will provide that on our social media channels after post-production. And we will also share all of those website mentions and those resources that were provided by some of our partners. For those members of the media who might have missed a question because of the live stream quality, please just follow up with our team and we will make sure to get you connected to the appropriate individual. Thanks again, and we will see you again soon virtually.